So looking at the lamina cribrosa as a structural biomarker in glaucoma beyond just the development of these peripapillary retinoschises, but glaucoma in general. So we know that the lamina cribrosa is highly associated with the development of glaucoma. This is a structure that is a fenestrated meshwork that's formed by collagen fiber bundles. The function of the structure is to provide structural support, but also nourishment to the retinal ganglion cell axons that are passing through. And we know that this is an anatomical site of injury in our glaucoma patients because it is biomechanically very weak. So it's very thin to begin with. It's 1 to 1.5 millimeters thin. And for context, this is about 1/3 of the thickness of the sclera at that scleral canal opening. In addition to just being thinner than other areas of structural support, the load-bearing connective tissue components within the tissue that is present is only about 40% of the overall tissue volume. So this lamina cribrosa just does not do as good of a job as the rest of the eye in terms of providing just overall structural support because it has added responsibilities of letting the axons through, letting the blood vessels through, and also providing nourishment to these structures. So in terms of remodeling of the LC in glaucoma, we know that this LC strain is mediated by a pressure dynamic. We have our IOP at one end and our CSF pressure at the other end. And then we have inherent variability within all of our patients in terms of their overall scleral and LC morphology and stiffness and thickness and just general structural variability. So if this strain reaches a point where remodeling does occur on a cellular level, we know that we can detect these changes by looking at our OCTs. So through using OCT to scan this area, we have been able to identify that there is a reduction in laminar thickness. We also can identify these localized defects that are present. And we also see an overall posterior displacement of the lamina cribrosa. So this occurs both at the laminar insertion points into the sclera and then also as an overall increase in the cup depth. So although we have always known that the lamina cribrosa is an important structural biomarker in glaucoma, we have not been able to successfully image this structure to a point where we're really involving this type of metric into our clinical practice. But with the evolution of high-resolution OCT and the advent of enhanced depth imaging, we're now becoming more and more capable of examining this very important and fascinating structure as it relates to our glaucoma patients. So as we continue to develop our OCT imaging, normative databases, and continue to do research in this area, this may be a structural biomarker that we start to implement in our clinical practice. So as we look ahead for implications for utilizing this structural biomarker in our management of our glaucoma patients, this may be something that could contribute to our ability to detect and diagnose glaucoma in our patients. This may also serve as a metric for monitoring progression in our patients. And perhaps most importantly, this may potentially help us elucidate which patients are most at risk for rapid progression.